Anyone have any doubt in hydrotherapy? No doubt. Okay, so you will be able to write the exam, right? So we'll go to the next topic, coordination. So now you tell me, what is coordination? What is coordination? Nobody has touched that topic. Coordination is over, right? I think theory is over, right? Everybody is silent. What I will take. Please let me know whether it is over, theory is completed or not. Okay, so able to do movement smoothly. Yes, coordination means able to do the movement smoothly and at a proper interval of time. Okay, correct. So today, like we will see how to assess the person. That is how to do testing, then how to give them the train exercises. So in during assessment, actually coordination will not be assessed separately. It will be assessed along with balance. So coordination and balance will be assessed together. So here, when you are doing assessment, you will be learning the complete coordination assessment when you are learning your neurology. So now it will be like you will be uh, just will have a brief idea about the assessment, then we will be going into the testing. So in the assessment, first is you need to find out what is their level of activity. That means what is their how far they will be able to do the activity. So, for example, if some person doesn't know how to lift the body, lift the hand more than 90 degrees, or if some person doesn't do or doesn't understand what is lifting the hand more than 90 degree, then when you are assessing also, you cannot say that they don't have coordination. Okay, so it is their skill or their level of activity itself is less. So you need to first understand what is the level of activity in a particular person. Then after that you have to know what is not what they are not able to do. So this is the first step. Next is you need to check for the extra movements. So whenever coordination is affected, balance also will be affected. So when this two is affected, definitely they will be having some kind of extra movement like oscillation, swaying, or some kind of unsteadiness will be there in a particular person. Okay, so unsteadiness means like not able to stand properly or not able to do any movement properly. If they are lifting a cup of coffee, they may drop it down or they may be shaky, all those things. So this shaky movements, oscillatory movements or swaying movement will be present in a particular person whenever they have this incoordination problem, or whenever their coordination is affected. Okay, so this point you have to note. So when you obviously see a person shaky, then it means that definitely they have this incoordination problem. Okay, then next is how many limbs are affected. All that means whether all both the hands are affected or only one hand affected, or both the legs affected or only one leg affected. So you want to know this also. Then distribution of coordination impairment. That means whether the coordination, whether the coordination is affected from proximal to distal or from distal to proximal. Or you can say whether only the distal joint is affected or proximal joint also affected, or proximal joint alone is affected. So it depends on the cerebral problem, or because the coordination is mainly based on the cerebellum. So it depends on how much it is affected in the cerebellum, the number of extremities, the problem, the joint involvement, everything will differ. Okay, so you need to check for their check how many joints are affected, how many limbs are affected, all those things. Okay, so first is you need to know what is the basic level of activity of a particular person before assessing. Then second thing, you check whether the person has any oscillatory movement, sway movement, unsteadiness or shaky movement in their hands and legs. So that one you have to check. Then next is how many limbs affected. Then fourth is what is the pattern of problem, whether it is from proximal to distal or distal to proximal. So next is you need to check what is the situation that alters the coordination. So situation alters means some people will not have any shaky movement at all. But suddenly if they hear some like loud noise, they will become shaky. Okay, so for example, small baby is there. Small baby means like some 4 years or 5 years baby boy is there. Suddenly, if you're shouting at the boy, what will happen? He may become scary and he may have trembling. Okay, he may fall down. He may have shaky hands. So this doesn't mean he has coordination. You need to check what is the situation that is creating. Is that clear? So that one you have to check. Then amount of time required for them to perform an activity. So this incoordinated person take time, or they will take long time for doing some activity. So this one you have to find out how long they are taking to just lift a cup of coffee, or how long they are taking to just take a tumbler from the table. So this one you have to check. Then what is their safety level? So for example, if they have very shaky movements, then you should not give any glass vessels to them. So they may, because of the shakiness, they may drop and they may hurt themselves. So this is the level of safetiness you have to check. Then you have to find out whether they have any history of fall. Is that clear? So these are the prior to assessment. This is also assessment. So these are the steps you will be looking after in this incoordination. Along with this, it depends on what kind of problem they have. Then according to that, you will be going in detail. Is that clear? So this is just a brief assessment of coordination. Then, so we can divide this coordination into two tests. One is equilibrium test and another one is non-equilibrium test. So equilibrium test means like it will be tested along with your balance. So you will be doing with eyes closed. But non-equilibrium test, you don't need to, like non-equilibrium test, it will not be assessed with eyes closed. Sorry, equilibrium or non-equilibrium, you have two things. One is equilibrium means balance, related to balance. So for balance, you will be checking with eyes open and eyes closed. But here, non-equilibrium test, you don't check your balance, so you just go with the coordination. So for that, you don't need to close your eyes, but only thing is you need to see how long they are taking the time and how far they are able to do very accurately. So accuracy, timing is very important for coordination test. Okay, so they have to accurately do the movement, so that then only you will be able to assess their coordination. Okay, so we have many coordination tests. So we have some are upper limb test and some are tested to do lower limb. Okay, so I hope like all these madam would have just went through whenever you are doing you have done your theory. So if not, you can just we can just have, or I think I will directly go into the practical part itself. Okay. So let me show you the videos. If you have any doubts in this test, then you can read it and you can come back if you have any doubt. Okay, so I saw the slides. I think all these are there in the slide. If not, you just tell me. So first, let me just show you how the incoordination patient will be. So this will give you some idea, because otherwise whenever we are doing with the models or like our own siblings and other thing, we don't know how difficult it will be for an incoordinated person. We may think it is very simple exercise, but you need to just watch how a incoordinated person will be and how difficult it will be for them. You can see here, this is a small boy affected by a cerebral problem. Okay, so he's very small boy affected by cerebral problem. It is called as ataxic cerebral palsy. So ataxic cerebral palsy means cerebral palsy affecting the cerebellum. So that's called ataxic cerebral palsy. There is no voice in that. I just want you to observe how difficult he is feeling. Okay. Can you see the swaying? Okay, so this is the difference between normal people and cerebral ataxic people. So they will be having a lot of a sway movement, that they will find it very difficult even to lift a small object and keep it in a particular position. Okay, so let me show you another one. This is Parkinson person. So Parkinson is a disease that will be affecting the dopamine in the body, and that will lead to this incoordination problem. Okay. So can you see how difficult he is finding it to have the fine touch? So the finer touching movement only will be affected. See how he is doing and how the lady is doing. Can you make out the difference? Okay, no problem. Okay, okay. Sure. Okay, okay. Sure. சரி மேம் ஆஃப்டர்நூன். Okay, so I just want to show this video for you to understand the difficulties of incoordinated person before going into the class. Because like when I'm teaching a simple movement, you may think that why it is so easy and why they want to find it difficult, all those things. Like you may think like that. So the because the movements will be very easy for us. Okay, so we'll just go into a quick reading, then I will show you the video, because without reading, then in between the videos explaining will be little difficult for me. Okay, so first is finger to nose. Here you need to make the person either stand, or you can also make the person to sit. So with standing and sitting, you have to ask the person to keep the shoulder abducted 90 degrees with the elbow extended. So here the person doesn't need to see the hand. He can just keep the shoulder at 90-degree abduction, then with elbows extended. Then he can make the tip of the index. He can extend the index finger alone. Then with the index finger, tip of the index finger, he has to touch his nose and do in alternative movement. That is, do with alternate hand. Okay, so here you need to think many of us will be able to do this, but we need to check how many of us are able to do very precisely, because in coordination the movement has to be precise, accurate and timing. So precise means tip of the finger means it is exactly tip of the finger to exactly tip of the nose. Okay, so you cannot just touch with the finger pad. So this is the first test, finger to nose. Then finger to therapist finger is same like that. Only thing is the therapist will be sitting opposite to the patient and the patient has to touch the therapist finger. Okay, so this also they can do alternatively. And while they are doing, you have to see how they are able to do, how what is the timing they are doing and how precisely and accurately they are doing. So this is the second test. Third is they have to touch finger to finger. That is, they have to stand or sit, keep both the shoulders abducted 90 degrees with elbow extended. Then they have to bring closer. The hands have to be brought to the midline and they have to touch the index finger. Is that clear? So this is the third exercise. The fourth exercise is they have to do alternatively to the finger and the nose. That means once they have to touch the patient's nose, their own nose, then other time they have to touch the therapist finger. So in all the exercise here, if you see, like our main idea is to know whether they are able to do accurately and precisely. Okay. Then the fifth is finger apposition. Finger apposition means the touching the tip of thumb of each finger. So that is called finger apposition. Then maybe I can show you in the video. So finger apposition is like this. So you have to touch using your thumb with all the fingertips. Fingertips means exactly on the fingertips. Okay, so this is finger apposition. Then mass grasp means alternatively you should be able to open and close the fist. This one. Okay, so here this one. Okay, so whenever you have problem with your balance, you also will have problem with your coordination. So for example, if any one of you have motion sickness, that means whenever you travel in car or whenever you're traveling to heights, if you feel dizzy or if you find it little difficult, then definitely you will find difficulty in doing all these exercise. Okay, so maybe you will be able to do one or two, but some of the exercise will be little difficult. So if you see like this. Okay, so when you're doing fastly, sometimes you will be missing it. So this is your mass grasp. Then next is pronation and supination with elbow extended closer to the body. That means the hand has to be held to the shoulder in neutral. Then you have to do supination and pronation. Maybe this you can do it over the lap on the patient's lap itself. You can ask them to do. Then slowly you can extend and ask them to do on the shoulder on the table like that. Then slowly you can also extend and ask them to do the movement. That is your pronation and supination. Next is rebounding. So rebound test here. Rebound test means you need to Okay, so rebound test means you need to position the patient in a particular position. So for example, you can just see, you can just position the person in so you can just position the patient and you can just flex the hand. Okay, so you can position them in sitting or standing, whatever position you want. So not only elbow flexion, you can do any of the movement in this. So after making them to flex the elbow, you can apply a manual pressure and further flex the hand. Then suddenly you just remove your hand. So when you suddenly ask them to remove the hand, so for example, you make them to ask them to flex, then you give pressure and ask them to extend. Okay, so it will be like doing isometric exercise. Then suddenly when you remove, they are supposed to hold it. Okay, so they are supposed to hold it. But people who are having incoordination will have a jerky movement. They may not be able to hold the hand immediately when you remove the pressure. Okay, so that is your rebound phenomenon. So next, if you see tapping the hand, that is like doing alternatively pronation and supination on the knee or on the lap. So that is tapping hand. Then tapping the foot. So you need to tap the foot, like doing ankle toe movement on the floor. So that is tapping the foot. Then pointing and pause pointing is you need to make the person sit opposite to the therapist. Then they have to hold the hand 90-degree flexion with elbow extended. That means 90-degree flexion means like this. Okay, elbow extended. Then the index finger of the patient has to slightly touch the index finger of the therapist. So that means like this. So therapist and the patient's hand will be like this. Then they will be like bending the hand. Then again they have to touch the finger. So usually when you bend the hand and when you're coming to touch the finger, sometimes you may go up or sometimes you may go down. But here you need to, normally you need to touch exactly on the particular point. Is that clear? So there should not be any overriding or underriding whenever they are doing this position. Then alternative heel to knee. So you can, using the heel of the foot, you can touch the knee then toe like this. This is, you can do it in lying position. You make the person to be in supine lying position, then ask the patient to lift the one leg and touch the knee and touch the toe like this. Then you can also ask the person to move over the shin of the other leg. Okay, then you can ask the person to touch the fingers of the therapist. Then you can ask the person to draw the circle like in the hand and in the leg. You can ask them to draw a circle. So when they are able to do, they should draw the circle perfectly. So it should not be coming the other way. Okay, it should be perfectly, they have to touch it. So either using the hand or using the leg, they can do this. Then holding position. Holding position means, for example, if you are holding the arms horizontally in front, uh, if that is just, you ask the person to flex or extend. So they are supposed to hold it in that particular position for long time. Okay, so these are the tests. So this is how you document. That is, you have some grading. You can see here the activity is impossible. That is grade 1. So grade 1 is activity impossible. Grade 2 is several impairment able only to initiate actively without completion. That means they are able to initiate, but they are not able to complete it. Okay, so that is called several impairment, severe impairment. Moderate impairment means able to do the movement slowly, but very unsteady and awkward. So that is moderate impairment. Minimal impairment means able to complete the task, but very slow and very normal speed. Is that clear? Then fifth is normal performance. So this is the grading that is used for non-equilibrium test. So using this grading, you can grade and you can write the comments. So this is like documentation. Okay. So can we go to the videos? Are you able to see this video?
No, miss. Miss, we cannot hear the voice, and so the video is quite laggy. Hello, miss. Sorry, miss. Are you there?
Okay, so next will be like they are going into balance. So we'll just stop here. I'll show you one more video.
Okay. Thank you, juice boss. வேற லெவல் ட்ராக் சொல்லலாம்.
Okay, so we don't want to go into balance now. So we will stop here. So let me give you some 10 minutes time, 10 to 15 minutes time. So can you just practice either you can practice on you, or if you have any siblings or anybody, you can just have a quick practice. So let me just screen share the test alone. So try to practice as many as you can. Okay, so the time is 4 o'clock now. We will meet again by 4:15. Is that okay? So if you have any doubt, you just chat. I'll be sitting here. You can just chat in the screen. Okay. Don't sit simply, please practice. Okay, so have you all done with this? Have you all done with this? Okay, so any doubt? Okay, so for the rebound test, we will not be able to grade it. We can just say whether it is present, present or absent. Okay, we don't need to grade it. Any other question? Is there any other question? No, you don't give more pressure. You just give a mild pressure to the patient and ask them to do it. So if you want to do elbow extension, you can just give mild pressure and let them just hold it instead of pushing you. They also no need to give more pressure, and you also no need to give more pressure. Here you're not going to check the muscle power. Here you're going to check only whether they are able to hold the hand or not. Okay. Any other question? Okay, so can we go into the exercises? So after testing and after documenting it, so we have to give them exercises to improve the coordination. So mainly like for coordination, we can use the same testing test as an exercises. So you can use the same finger to nose test, tapping test, everything as an exercise, and you can improve the coordination. Is that clear? So all the non-equilibrium tests can be used as an exercise, and you can use it to improve the coordination. So apart from that, a person called Frankel, H.K. Frankel, he has formulated a particular exercise to improve this coordination, and that particular exercise is called Frankel's. So in this exercise, if you see, the main three essential part, or you can say principle, is you have to concentration, precision, and repetition. That means with the help of making the person to concentrate on the movement, with the with the person's precision, making the person to do a precise movement and giving many repetitions to achieve the precise movement, we will be able to improve the coordination. I hope you got it. That means by making the person to concentrate on the particular movement, by making the persons to repeat many times to achieve a precise movement, we will be able to improve the coordination of the particular person. Clear? So that is the concept of Frankel. So here, how we can able to make them to concentrate. So if you want to make them to concentrate on a particular moment, you need to position the patient in such a way that they should observe, or they should be able to see the movement happening. Okay, so don't give the movement in supine lying, give the movement in half lying, or give the movement in sitting or standing, so that the person can see the movement, see his limbs doing the movement. Okay, so like that you will be able to obtain the concentration. Then next, to obtain the precision, you have to make them to repeat n number of times. That means we don't have frequency for this particular exercise. The person have to do n number of times to achieve the, till he is achieving the precise movement, you need to make them to repeat it. Okay, so these are the two things. So you need to improve his concentration. For that, you need to position the patient in a proper position in such a way that they are able to watch your movement. So that is first thing. Second thing, make them to repeat n number of times so that he achieves the precise movement or accurate movement. So till he is achieving the accurate movement, you have to make them to keep on repeatedly do the movement. So these are certain principles or you can say the guidelines which you have to follow. One is position the patient and suitably clothe the patient so that he can see the limbs throughout. That means he has to see the limb throughout the movement. So in that way, you have to position, and in that way, you have to make them dress. Then second thing is, you need to explain them and demonstrate the movement so that the patient gets a very clear picture. So in that video, in the first video, if you see, the teacher asked the student to do heel heel to knee and heel to toe. So if you see, the student did not touch the exact part of the knee. He just touched just above the knee. So like this movement, you should not encourage this kind of movement. You have to explain them very clearly what you want them to do. Let them get a very clear picture. If they don't get a clear picture, you sit in front of them and demonstrate it. So once you demonstrate it, then let the patient do it with full concentration in such a way that they are able to do the movement accurately and smoothly. So he has to give his full attention towards the movement. Then the speed of the movement is normally dictated by the physiotherapist by counting numbers or by moving his hands or by suitable music. Okay, so the speed will be controlled by the physiotherapist. Then the range of motion is indicated by making different spots or different marking pens. Then the exercise is repeated many times until it is perfect and it is easy. Once they are doing that particular movement very perfectly, and once it becomes easy for them, go for the next difficult one. So don't just do all the movements in one day. You will start a movement, maybe till you achieve that particular movement, you will be keep on doing that movement. Once they achieve the movement, then you stop it, then you go for a little more difficult one. Okay. So because of this, the exercise may find little bit tiring. Then so you can give them frequent rest, because you're not going to do 10 times or 15 times. You are going to do n number of times till they are able to achieve the particular thing. So you need to give them proper rest period in between, and the patients will retain little or no ability to recognize fatigue, but it is usually indicated by the deterioration of the quality of movement, because the person will not tell you that he is fatigued. So you need to see how they are doing the movement. If the quality of the movement is reducing, then you give them rest. Okay. Then progression is normally done by increasing the speed, increasing the range, then increasing the complexity. Okay, so complexity means by doing a little more difficult tasks. So that is called increasing complexity. Okay, so we will just see with the exercise. So let me just show you the video, because with the slides, it's difficult for you to understand the exercise. Just a moment. Okay, 1 minute. Let me just explain the exercise first. So for example, if you want to do movement for the hip, So what you can do is you can position the patient in supine lying. Then you can draw different markings on the bed. Then you can ask the person to flex the hip and touch the particular marking. Is that clear? So in supine lying, you will be drawing different lines, maybe with different colors or different color pens like that. Then you have to ask the person to do flexion and touch the particular color. Okay, so for example, if you have drawn blue color, red color, and yellow color, then you can just say, okay, now lift your heel and touch the blue color, then touch the yellow color, like that. So initially, the patient may not be able to touch exactly, but you need to ask them to drag the leg and touch the exact point. Okay, so they can drag the leg and touch the exact point. So once they are able to drag and touch the exact point, then you can increase the speed to increase the progression. Then later you can also increase the complexity. So how do you increase the complexity? So for example, if you have marked red, yellow and blue, so first will be red, then yellow, then blue. So then you can ask the person to drag the leg to red, yellow, then blue. Then if you want to increase the complexity, you can directly ask them to touch yellow, then come to blue, then come to red, like that episodically. Is that clear? So this is another way to increase the complexity. So once the person is able to do this with dragging, then you can ask the person to lift the leg and touch the particular point. Okay, lift the leg and touch the particular point. Then if he is able to do that, then you can ask him to do the movement in air. So no need to touch the line. Let them just do the movement in air by holding above the particular point. Is that clear? So like this, you can give for flexion. You can also do for abduction. Same thing you can also do for upper limb. Okay, so now you just watch the video, you will get some idea. Okay, so you got an idea? So there are a few more videos. I think we will continue tomorrow, as I have to go to office to talk with Dean. So I'll stop the class here. We'll continue tomorrow morning, 10 o'clock. Okay, so and if you have any other doubts in hydrotherapy, that also we can discuss tomorrow. Is that clear? Okay. Okay, thank you all.